Hello, John Miller, osteopath here. I'm going to give you some exercises today to try and deal with ulnar nerve palsy as a result of compression in the brachial plexus. So the brachial plexus is an area just underneath the clavicle, which is the collarbone here, and it carries a bundle of nerves and blood vessels to the arm. If there's any compression for any reason at this point, it can give you all kinds of symptoms. What we call, say, carpal tunnel syndrome can often be confused with it, and you can usually get pain or numbness or loss of sensation, loss of power in your limb. Most commonly, of course, the ulnar nerve is affected. The ulnar nerve controls fine motor control in the hand, and you will notice you'll get tingling and numbness, usually in the little finger and possibly even half of the ring finger here. So how can we treat this? And how do we know if it is ulnar nerve palsy? Well, assuming you've done all the tests to make sure that it's not coming from the pisiform bone, flexor carpal ulnaris, or the elbow joint itself, or even the neck for that matter, you want to have a look at the posture of the patient, and I usually look to make sure they're not sitting or standing in this kind of status position. What you tend to find is if someone's been sitting badly for a period of time, the pectoral minor muscle, which attaches in the coracoid process here and comes down across to the ribs 3, 4 and 5, okay, that shortens, and as a result it draws you down forward like that. And you can see with the elbow position, very often you'll see people, instead of standing nice and straight, they stand like this and the elbows almost come back. Even if the posture is quite good, the elbows are still coming back because it's been drawn forward at this point. So we've got to try and get this loosened off. And one of the best ways to start off is to use a tennis ball, or better still, a nice spiky ball. These are really good, and they can get into those tissues and start to loosen them off. And sometimes that's enough on its own. So get the ball, come to the upper part of the pec here, first of all, just from the inside of the shoulder joints, and simply massage by circularly going into the shoulder like that. Try to make sure that this arm is relaxed. Just work your way in. Spend about 2 to 5 minutes doing this, making sure, of course, you don't fatigue the other shoulder or cause a problem there as well. Once you've done that, once it's nice and warm, you're going to try to open up the chest and back a bit more. And one of the ways we're going to do this is to try to pull the shoulder blades together and down and back. So if you have one of these bands, start off by bringing it above your head, as if you're doing a pull down, and pull to your chest. Now, don't just pull without thinking about what you're doing. So you want to be emphasising pushing the chest out, that peak contraction there, okay? So just really squeeze the shoulder blades together at the back. You want to work this part of your back here, so that's your rhomboid muscles, the lower trapezius muscles in particular, and of course the rear deltoids and the rotator cuff of the back. So to do this again, so put the band in front of you, pull down to the chest, pull apart, squeeze the shoulder blades and release. And pull apart and squeeze your shoulder blades and replace. When you do this, of course, don't let go of the tension in the band. Try to remain at what we call a peak contraction at all times, to really build a sense of contraction through the back of that area between the shoulder blades and beneath it. And once you've done that, to try and get back in to this pectoral minor properly, we want to try and do a stretch. So bring the band above the head, grab hold of the band here, pull it down. So as you can see, the arm is nice and high. Now I don't want to see your head dropping forward. Your head's going to be upright, nice good posture there. Tummy tucked in, and pull. There we are. That's how you do it. I'd like you to spend about 30 seconds to 2 minutes stretching through there, okay? Once you've done that, give it a bit of a shake, let the blood get into the area, and it should start to loosen things off. Of course, now you've done these stretches, you also need to think about your posture. So when you're sitting or standing, try to make sure your shoulders are down and back, and you're not getting into this habit. Again, like I said before, look to make sure when you're standing, your arms are not coming off the centre line, and the elbows not drawing themselves backwards here. Give that a try, see how you get on, and see you in the next video.